Sorry, give me a second. Sorry, everyone. Sorry for the brief delay. Good afternoon. I'm Christian Dorsey, a member of the County Board, and joining me today is our chair, Libby Garvey. And we thank you all for joining us for our discussion on COVID-19. We've now been doing these town halls for the last 4 months, and as always, we will convey pertinent information on the pandemic's spread and our governmental response here in Arlington, while of course addressing your concerns, your questions, and your suggestions. If you are participating through Facebook and the Facebook Live format, you can populate your questions for us to address via the chat function. Otherwise, you can go ahead and actually text questions if you're not using Facebook or just prefer to use the text function. And can someone tell me what that number is? I don't have it offhand. Actually, I got it, 571-348-3053. So for our discussion today, in addition to Libby and I, we also have several members of our county's executive leadership team with us, including Deputy County Manager Jim Schwartz, Dr. Aaron Miller, who's the Director of Emergency Management, and our Director of Public Health, Dr. Ruben Varghese. So we've now been in phase 3 of Virginia's plan for reopening for a little over 3 weeks. And we have seen a resulting increase in cases in the Commonwealth of Virginia, as well as an uptick in the percent positivity or the positivity rate, the number of people who test positive for each diagnostic test performed. A lot of that increase is driven by some spikes elsewhere, particularly the Hampton Roads region. Here locally in Arlington and Northern Virginia, we have seen the numbers staying relatively steady, at least at a healthy positivity rate. For Arlington, ours hovers just a little over 5%, and that's been the case really for about the last month. Just so you know, there have been about 26,000 diagnostic tests for COVID-19 that have been administered in Arlington, and most of these have been through partnerships that we have to provide easy access for residents in the community. We have a drive-through testing site, which is on public property on Quincy Street across from Washington Liberty High School, and our partnership there, originally with Virginia Hospital Center, is now with Quest Diagnostics. And we also have a walk-up site down in the Arlington Mill neighborhood, actually at the Arlington Mill Community Center. So these are part of our efforts to remove barriers that hinder access to testing, both because of geographic constraints, but also due to needing various ways of accessing tests through a physician's note or otherwise. At the Arlington Mill site, one does not need a physician's note to access testing, which is especially beneficial for uninsured or underinsured residents. And at our Quincy Street site, you can access referrals through your doctor, through telemedicine, and through phone consultations in order to get access to the testing that you need. Of course, we've been at this for a while over the last 4 months, but the news about COVID and our governmental response is ever changing. So we like to keep the community up to date with the latest information through our webpage, the COVID webpage, which is at arlingtonva.us/COVID-19. That is the best source for you to keep handy and to bookmark so that you can always have access to the latest information that we have available. Speaking of that website, why don't we go to it right now just to take a look at some of the features that may be of interest to you. So if I can share my screen, and if you'll give me a moment for that to load up.
Bringing up our new dashboard, right, Christian?
I am. Now tell me, I can't see what we're looking at. Is it showing it yet?
I don't see it yet.
Don't see it.
Maybe Ms. Helfer should do it, and we won't get the echo. Now you're muted.
Actually, I think,
If someone
Ruben,
else
you
can
have
do
it
it,
up.
I'll navigate through it.
Let me see if I can do it.
You've got it, Doc. Thank you.
Okay, so
All right. So thank you, Dr. Varghese. So if you look at the latest addition to our COVID-19 site, it is a more streamlined and consolidated with better data visualizations dashboard of COVID in Arlington. So you will go to a home screen, which gives you a synopsis of the current state of play on some key metrics. So there you can see the total case count, but you can also compare it to the number of cases yesterday. As you'll see on the right, it gives you the number of new cases between today and yesterday. So you can look at the daily increases, as well as in hospitalizations, as well as in compiling any people who have died from the disease. You can also see some other key information about the case rate, so the number of cases that we have per 100,000 people in our community. If we'll go down, there are a number of other interesting areas where you can look at. Many people are often interested in seeing what's happening a little bit more locally. So we have data compiled by zip code, where you can take a look at the residential zip codes in Arlington and take a look at the number of cases, as well as also that case rate. As you can see, and as we have talked about for a long time, the preponderance of cases that we have are coming from the 22204 zip code, and you can also see that corresponding in the number of cases per 100,000 persons. We also have significantly relatively higher case rates in the 22203 neighborhood, and throughout you can see how this looks by geographic entity. We also have the demographic data that people are often interested in, looking at our cases and deaths by age. And there you can see that we have, as is typical with the national story, this is something that can affect people across all age ranges, but is particularly something that we see, growing with your age in terms of your susceptibility, which is reflected in the death tab. If we can go to that, Dr. Varghese. Whereas while the cases may be well distributed, death rates are not. So this is something that continues nationally and in Arlington to particularly be something that affects older Arlingtonians, especially those with underlying health conditions. Next, we've also been able to take a look through the rigorous efforts of the Department of Public Health at race and ethnicity data. Just by way of background, these are not typically well compiled by the testing entities, nor is it required by the Commonwealth of Virginia, but our own Department of Public Health takes very seriously through its own efforts to try and match known cases to a race and ethnicity to figure out what the demographic impact is. And here you can see very clearly that our Latinx population in Arlington is disproportionately negatively affected by a higher case rate. The same is not true for African Americans, for Asians, multiracial, or indigenous persons, but still our Latinx population is bearing a disproportionate burden of the case rate. We also have some data on how these cases are mapped out by the date of symptom onset, so we can sort of take a look at the spread in the community. So here we look on a weekly basis, the number of cases that we can ascribe to symptom onset, and you can see how we've had a growing peak that occurred during the middle of the pandemic thus far, and that we have been on a decline since then with some peaks and valleys therein. And the last couple of things, testing is always something that people are interested in. And here we are showing the amount of testing that's occurring in our community so that you can see both the negative tests, the positive tests, and the trend line indicates the positivity rate. There are lots of different people who look at positivity rates and numbers, but as I said, for Arlington, we have been at around the 5% level, not just in the most recent week since we last convened a town hall, but that's pretty much been where we've been over the last month. And then the last tab on the dashboard is looking at all of the ways in which you can get tested for COVID in Arlington. So it gives you a sort of chronology of what you should do, who you should call, and then ultimately how you're going to be able to access the testing that you need. And the last thing to sort of say about this before we get into some hard, concrete conversations about the numbers with our public health director, when you look at how COVID is spread in Arlington, our first case was recorded on March 9th. And it then took 23 days for us to reach 100 cases in Arlington. And then it took about a month to go from 100 to 1,000 cases. And then it only took 28 days to go from 1,000 to 2,000 cases. And that occurred on or about May 28th. And here we are 56 days later, and we've not yet reached 2,800 cases. So we haven't quite yet hit 800 cases since May 28th. So the course of the virus is certainly slowing in its intensity and spread. But again, what that means, how we process that, that'll be part of what we have a conversation with our public health director. Over to you, Libby.
All right. Thank you so much, Christian. We're getting a lot of questions kind of about what can we do, what have we done. So I'm going to give a little bit of information and then try to address one or two of the questions and hand it over to Dr. Varghese, because there are, as I say, a lot of questions about, really what is going on and what are we doing. So first, we do have a COVID hotline, which I want to just let people know, 703-228-7999. So 228-7999. And that, the hotline is to answer questions about COVID testing, government services, food, housing, and more. It is getting a lot of use. We've received over 7,447 calls. It's probably up to 450 now. So a lot of people are using it. Thank you. We also appreciate people are letting us know a lot, and which is very understandable with their concerns about distancing and face coverings and people not doing what they should. And people have been reporting that, and we actually appreciate that because we cannot be everywhere. And I think as everybody knows, or everybody should know, as we get further into this phase 3, it is crucial that we really double down on the social distancing, the wearing face coverings and washing your hands, et cetera, to try to make sure this virus doesn't spring back, as we're seeing in so many places that is happening. Personally, I'm staying in phase 2. Basically, I don't go out if I don't need to, and I'm being very, very cautious, and I encourage folks to. That safer at home still really applies if you can do it. We are doing our very best to encourage and support businesses and individuals to follow the protocols. We ordered a huge number of masks, and those are being distributed in all kinds of different ways, which we might cover more later. We also have our We Are Covered program, which is continuing to grow. And I should have asked Ms. Helfer maybe to pop up the logo, but you can see it online. And this is a way that businesses and multifamily properties and religious organizations, they can sign on to doing this, and they say that they are going to follow all of these protocols, and then they get a badge. And that is a way to show customers and visitors that this particular place is committed to upholding Virginia's requirement for face coverings and more in the public buildings, and making sure people distance. And we really encourage everybody, all kind of multifamily buildings, faith organizations, and businesses who've not done it yet to join us in this effort. It's really crucial. And we encourage residents and citizens, when you're coming up to a building and they don't have that badge, ask about it. I think the more that businesses particularly hear that their customers want to know that they can feel safe inside their establishment, the better off we will all be. So, and if you don't see it and you feel like telling the property or business owner that you're not entering because they don't have it and you don't feel comfortable, the better off we will be. So this really is an undertaking that we all need to work on, and appreciate all the support we've been getting from folks. We also have been working, I think, as people are aware, with our temporary outdoor seating area program. We call it TOSA. And this is a way we are helping restaurants to be able to serve more outside. Obviously, it's safer outside. And we've so far gotten 99 applications and approved 71 so far for outdoor seating areas that allow restaurants to more serve outside. And we're going to continue to work on that. We are working hard to help our small businesses simply survive. We've provided almost $2.6 million to over 370 small businesses in Arlington, and we've got more money we will be providing. And this is part of our Business Emergency Grant Program, which is a grant, nice acronym, giving resiliency assets near term. And the point is to help the businesses survive. And by doing that, you also help the employees of those businesses really to be resilient as a community. We need to have our small businesses continue to stay with us. Of course, many of our residents, as we know, are having difficulty paying the rent. That's getting harder and harder, and putting food on the table. So far, we've provided about $3 million for 1,400 households for rental and other emergency assistance. And anybody listening who thinks they might need assistance or knows somebody who does, we've got another phone number, 703-228-1300. And please call that 228-1300 if you need help. And we are so grateful. In conclusion, I just want to say to the many organizations and individuals who've really stepped up to help out. These include our PTAs, our faith-based organizations, Meals on Wheels, our Arlington Agency on Aging, and many restaurants and other organizations helping to provide meals. We formed the Cooperative for a Hunger-Free Arlington not too long ago, and they are helping to coordinate all of these efforts to provide food, and so far have provided about 24,400 meals and groceries to COVID-impacted households, and they continue to work. And then I suspect we will get some questions about Arlington Public Schools. As we all know, the superintendent recently decided to begin school virtually in the fall for all students. I think the issue of our schools and daycare is probably the most difficult issue our community is dealing with. Our manager and superintendent talk almost every day. I speak at least weekly with the school board chair, and I know my colleagues and I have conversations on a regular basis, informal conversations with our school board colleagues. We all really want to help our schools devise a plan that will make work to make sure our most vulnerable and at-risk students get the education they need, that our children are cared for, their parents can work. We have committed to ensuring that every student and staff member that needs it has quality internet access to online teaching and learning, and we continue to work with them and do what we can to be supportive. So I think we'll get to questions. I'll answer one of the questions early on was has the board done anything to push back on the governor's reopening plans? And as a matter of fact, yes. Actually, I personally made some fairly impassioned calls way back in March for St. Patrick's Day. And since then, we've been working a lot on a regional basis. And when the governor was moving the whole state from phase, what you call 0, I guess, into phase 1, we realized we were not ready as a region. And we came together and went to the governor and asked for a 2-week delay, which we received. We continue as a region to work together, following the metrics, and are totally prepared to push back and talk to the governor if we see things not going in a good direction. I think over time the governor has gotten more receptive and realizing how important it is to talk to us about where we are. So I will go off and toss a question to Dr. Varghese, I think, if he could set us up and talk a little bit about where we are and where the region is with our public health metrics.
Thank you, Ms. Garvey. So I think one of the things that I'll start once again, reminding people that while things have improved, we still have community-wide transmission. And our real definition of that is when you cannot determine in the majority of the cases who people came in contact with, like that we can't make the case of this case led to this case, led to this case, having that chain. And when we can have that on a more consistent basis, we would be out of community-wide spread. So although, as Mr. Dorsey showed during the look at the dashboard back in April and May when we saw the peak of our cases here, we still have the same situation where the majority of the cases, as we talked to, we cannot identify the specific place or people that people have come in contact with to have that spread. So that is why we are still saying there's community-wide transmission. Having said that, I've also indicated that as a region, we have done better over time. We peaked in April and May. We've been seeing, we saw a decrease. We're now at a plateau in many ways. So for the metrics that the governor put out in April, some of the things I want to mention. So the percentage of positive tests over a 14-day period, that's that percent positivity of the nasal pharyngeal swabs. From the period from July 10th through July 23rd, this metric for Northern Virginia has overall declined from 7.5% to 6.2%. It's a decline. It's not a huge decline. I'd like to get that number to zero. Not going to be likely given that we still have community spread. And yet for Virginia, if you look at outside Northern Virginia, there has been, for that same time period, a steady increase overall, and the same thing for Virginia. And so in a sense, the reason why I asked staff to look at it that way is now we're seeing more of this happening in other parts of Virginia, and given how much is there, it overwhelms, in a sense, the state picture of what may be declining or steady here in Virginia. For COVID hospitalizations over 14 days, another one of the governor's metrics, there's been no steady increase or decline over this for the last 14 days. It's, of course, much better than it was in April, May, and the beginning of June, but as it's come down, we've hit a plateau. However, in the rest of Virginia, and when you look at Virginia as a whole, there's been a steady increase overall over the same time period. So this is the context in the sense that we live in as well, so people need to know. One of the other metrics was increased testing that the governor has proposed. While there's no 14-day metric for this, compared to, say, the period from July 7th through July 20th, the last, or let me change that. From the period from June 26th through July 9th, we had about 2,537 tests per day. In the period from July 7th through July 20th, we've had about 3,000 tests per day in the region. You have to realize, though, that this is not a metric that I anticipate is going to continuously go up over time, because you also need, even if there was plenty of testing, not everyone's going to go and just go get tested. It's actually one of the things that happened in DC, where they offered more testing, but they've actually reduced what they're doing because people weren't going for the testing. So it's just a context. Just because you have it doesn't mean everyone's going to go do it. And then the other two things that the governor had proposed, enough hospital beds and intensive care capacity. The region has not actually had to use the surge capacity. The extra capacity for beds has not been utilized, which is a good news. And we still have, the hospitals are able to get adequate supplies of PPE, although the ability for private practices, long-term care facilities, and some first responders it's a tenuous situation.
Dr.
Is it okay if we stay with Ruben for a little bit?
Yes, please. And I wanted to follow up because we've gotten a lot of questions, which I know is an important issue. The delay in getting back the results on testing. I think that might even affect whether people decide they're going to get themselves tested. If they, know it's not going to be for 14 days, then you might as well start quarantining again, right? So could you talk a little bit about the delay and how we're doing with that? I think it varies by site as well. And maybe explain why, because people may not understand the different testing.
So assuming that all testing is equal, that they have all the access to the materials at the site where it's being collected, it is not something that is done in each locality because it is not a specialized, it's not a specialty that has been actually done throughout the nation where you have local lab capacity to have that done. So when you have groups like Quest and LabCorp, and sorry, this is not a ad for them, but they are the two largest providers in the nation. When a lot of people use those labs to send the test samples, depending on the volume and where it's sent in the nation, it can actually affect the situation. And so if there are hotspots elsewhere that suddenly are testing, or say, for example, universities are now saying you need this before you're going to show up, you have a confluence of lots of people possibly getting tested from all over that can lead to delays. So that is a known concern. We've actually elevated that to the Virginia Department of Health, and they're working with the governor's office to figure out, are there ways to actually increase laboratory capacity in Virginia to help reduce the turnaround time? Because obviously, if you discover that there's a test positive, but you only get it 10 days after they've had the sample, the contact investigation, which my staff still will do, may be less valuable for the sole reason that those individuals, we couldn't get them into quarantine as close to the time when a case would have been identified if they could have a more rapid test. Unfortunately, it is one of the issues of us not, as a nation, having a national strategy to start increasing the laboratory capacity to get over this hurdle.
Right. I had some more, but Christian, why don't you go ahead for Dr. Verghese, and we'll give you a break soon, Dr. Verghese. Sorry. Sorry.
So, Ruben, Dr. Verghese, so people are wanting to understand this concept of community spread from your public health perspective a little bit more. So what are there other indicators besides the positivity rate that you look at in determining the prevalence of community spread? If so, what are they? And then I'd like to have you go into our contact tracing program a little bit more. And if you are having any difficulties in getting compliance from people that you seek out to do contact tracing with, and what have been some of the experiences, both good and bad, thus far?
Okay, let me take the community widespread again. So in many ways, it's almost what we're not seeing. So when I go back to, as we interview people, if we don't see an increasing trend of the ability to identify the connections between cases. So what happens is it's almost the negative. It's just like proving that prevention has worked. If we don't identify more and more people where the connections are, that's partly related to the number, and there's no actual magic number. You could have 1,000 cases, but if you know all of their sources, that's just as important as if you have 500 cases, but you don't know the sources. We're more in that latter situation where the cases, we still don't identify them. So you can look at positivity rate, you can look at the number of cases as a gestalt to say, while we still see that, well, that is much more likely that it's community spread. And that's why we look at the Northern Virginia numbers, and that effect, we look at what happens in DC and Montgomery County and Prince George's County and so on. They're all having the same phenomena. So in our region, that's the thing. That's why I've said it's not just Arlington numbers that we look at, because we do not have that bubble. We're not an island like New Zealand in a sense that can control where the germs are coming from, because germs don't respect boundaries. So it's a gestalt ultimately of, is there community spread? But to reassure people, it's if we start seeing significantly that we can identify the sources and the numbers are down, then we'll be heading in the right direction, if that helps.
Sure. And so, generally, just to sort of simplify at least community spread from a public health perspective, it is not as simple as just looking at what may be the day-to-day change in number of cases. You have a lot more data points which influence your public health concerns about how the virus is spreading in the community.
Well said. And that's why I think people have really defined community of Arlington. And we've got to realize we are affected by our geography. And so 20 cases per day in Arlington and 15 in DC and 8 in Fairfax is what we need to look at, not there are only 3 cases in Arlington, we can declare victory, because unless we are not restricting travel and never let people leave, we need to look at what's happening in the region. And all of us have cases that go up and down. It's better than it was in April and May, but we haven't seen the numbers continue to decline. And that's the thing that people need to realize. We're looking for ultimately getting to 0, and we're not there yet on a consistent basis.
And on to contact tracing, just to close this loop. So you talked about where we are in terms of the tracing is indicating spread continues. Have you had any difficulty with people being cooperative with helping your contact tracers figure things out?
Great question. So as a reminder, we start with case investigation. We get the laboratory report or the doctor's report about a confirmed or probable case. And based on that, we interview the cases. Usually the most difficulty for that will be if they're too sick or if they're in the hospital, we may not be able to get the information, because if, God forbid, they're on a ventilator, there may not be the way to get that. Fortunately, most people don't immediately go from being positive to having that sort of outcome. That would be the more difficult situation, but staff have the ability, if they've got family members, to ask who they may have come in contact with, and reminding everyone we're looking at that within 6 feet of each other and spending 15 minutes or more on a cumulative basis, say within an 8-hour time frame, as a rule of thumb for folks to maybe understand. And so we've actually had good cooperation overall, and we have active monitoring where we then check in daily to make sure the cases have the support they need so that they're not going out and doing those things as well. And for high risk contacts, we've done the same thing, and we haven't had any significant concerns that, you know, there's any one in particular that we need to potentially pursue. There are legal remedies to do that if we really thought there was someone putting the public at risk. That is something that the Commissioner of Health in Virginia can actually help us with if that's absolutely necessary. Fortunately, what's great about people in general, and this is true not just of Arlingtonians, but the region, people want to help and prevent the spread of this when they're sick. So that's actually a very good thing.
All right, thank you. I have one more easy question, question for Dr. Varghese, and then maybe we'll move into enforcement issues. We're getting a lot of those kinds of questions. So Dr. Varghese, you gotten one question, which I think is actually quite a good one. What's the best time to get a flu shot? I think we can't forget there are other things going on besides COVID, right?
Sure, absolutely. So the best time normally, I would say, is just before flu season starts, or as it typically starts to rise. So really towards the end of September, beginning of October is typically when we would see flu in the U.S. and in the region. So one, it has to be available. That's going to be one of the things. We've heard nothing to say that it's not going to be available, but those are things that are obviously things we have to always pay attention to. And when it's available, then prioritizing and going out and actually getting it. We've seen more and more places, you know, pharmacies make it much more easy at this point to get those sorts of vaccines. So yes, flu shots are important because you do not want to get flu and COVID. And to parents, the reason why, even if we're going virtual at the beginning of the school year, the requirements haven't changed. We have appointments to make sure that children can actually get the vaccine so that whenever schools do reopen, that they're not potentially passing the childhood preventable vaccines or diseases.
Yeah.
So we want to make sure that parents take advantage of our appointment-based system now to be able to actually get the vaccines that their children need for safe school reentry.
Thank you. Yeah, public health is about more than just COVID, and we need to keep up with that as well. Thank you. So, Christian, I don't know how do we want to frame, maybe an update from, it might be Jim Schwartz, kind of on what we're thinking, what we're seeing with compliance with face coverings and people doing what they should do, and because I'm seeing a lot of questions along those lines. Would that be a Jim Schwartz question, perhaps?
Sure.
So,
Sure,
and Jim, just to put a little finer point on it, if you would identify some of the challenges that we have seen officially with compliance with guidelines and restrictions, and then what are some of the ways in which we're planning on approaching dealing with those issues?
Yeah.
So thank you both. This is probably the topic of multiple conversations every day here recently, certainly since we moved into phase 3 and we've seen more activity in our community. The big challenge that we have is that people are anxious to get outside. People are anxious to socialize. They were somewhat denied that or asked to curtail their activities for months on end. Despite the warm temperatures we've had here recently, the weather's been better, obviously, than when this all started. So people are anxious to get out and, enjoy themselves beyond where they were for a couple of months. What we're seeing in the community, quite frankly, is too many instances of people not wearing face coverings when it would be most appropriate. That is when they can't maintain the social distancing of at least 6 feet. And that 6 feet, I should note, is when they are with anybody that is not from their own household. And it is not 6 feet in one direction, it is 6 feet all the way around you. And I raise that specific issue because we are finding some difficulties in some of the areas where people have gravitated towards our restaurant and bar activity. Queuing on the sidewalks has been somewhat difficult. We are finding largely very cooperative restaurant owners and managers. The community may be familiar with something that was started here by our police department a couple of years ago called the Arlington Restaurant Initiative, which was started to get our restaurants to deal at the time mostly with underage drinking and capacity issues, those sorts of things. But the program really was really rooted in cooperation with the restaurant and bar community. And so our police department, our public health department, our fire marshals have a really, really good relationship with many of the restaurants where we're seeing these activities taking place. So the Arlington Restaurant Initiative has been out there trying to gain cooperation. We're going to see probably some increased activity on the part of the Restaurant Initiative here in the next several days and weeks to come. Again, just trying to be out there and encouraging people. Our tools for enforcement, when people think about enforcement, it's, what is there a penalty? What is the penalty for not complying? We'd really like to avoid that if we can at all and see if we can get people to cooperate. But we are looking at more ways that if we absolutely have to, we might be able to impose some kind of civil penalty where appropriate. I would tell you also that this is somewhat of a gray area. One of the things that has popped up as we've tried to encourage restaurant and bar owners to help us out is the governor's order talks about congregating. What exactly is congregating? Restaurant owners are not in a position to make clear judgments about that, so they're trying to walk a fine edge here also. So I would say that right now, while we continue to look at trying to gain as much compliance as possible to what the governor and our own Dr. Varghese has recommended that we do. Really, we're looking for people to, participate in a willing way while we continue to look at what kinds of enforcement mechanisms we may employ. I would note, too, that this isn't just about bars and restaurants. There are lots of places that people still want to get back to. Places of worship. I know we have people that are questioning, and again, we've seen a lot of our places of worship either continue to do online worship or outdoor worship, which we continue to highly encourage. To the extent that people are still participating on indoor activities as they are allowed under the Phase 3 order by the governor, we certainly encourage people to continue to wear face coverings, social distance, and we strongly discourage from choirs or singing where we have discovered, public health officials have advised that the opportunity to expel viral droplets is far greater when we are either talking loudly or singing. So again, it's just back to the, what we tried to to encourage in our public education campaigns, be covered, continuing to social distance, continuing hand sanitization, and do everything you can to be outside and monitor your surroundings.
Mm-hmm.
All right.
And I'll just say thank you, Mr. Schwartz, and for our community, because we get a lot of questions on this, both during this chat and otherwise. And, people wonder whether we can mandate the wearing of face coverings whenever people leave their home. And technically, there is a question, legally as to whether you can do it. And then, well, if you do, well, how are you going to assure compliance? And I just want to make sure people understand that the issue with not wanting to have criminal solutions to people not having mask compliance are also a result of just practicality. We just do not have the ability to be everywhere to equitably and effectively enforce prohibitions. So while we're figuring out exactly how you do that, we really need to figure out how to be effective in getting voluntary compliance through all of these other means. It's not just because we don't want to go through the effort of enforcing this. It's practically very, very difficult. And so we've gotten some examples. What do we do about people who are running through the seating areas on sidewalks? At a point in time, if our police are not there or a public health official is not there, there's nothing that can be done about it unless we have a culture of compliance where people advise and admonish the runner, the business admonishes the runner, and hopefully that runner recognizes how they're infringing on other people's opportunities and potential to be safe in the community. So we're really tripling our efforts to try and get everybody to get this, because that's the most effective way that this is going to happen. But that said, we're figuring out where, if penalties can be applied, how we do that in a way that's going to be effective.
Yeah, and we may need to gradate the penalties. So it's, because right now it's something really, really bad, like jail time and over $1,000 or nothing. We got to get in between. Jim, I think you had something more you wanted to say.
Actually, Mr. Dorsey just handled it. I wanted to point out that, for us to actually take a legal action, either on a civil or a criminal citation, we have to witness the infraction. So we do still want people to call us and let us know where they are seeing trouble spots, and we will do everything we can to go out and try and gain cooperation. But we can't be citing people just based on an observation of somebody that may have taken place before the arrival of a public health or a law enforcement official.
Thank you. And I think you hinted in your, hinted is not quite the right word, you mentioned but didn't go into depth. What I think we are all really aware of, that there's certain times and places where this is more problematic, and we are particularly seeing this like after the hours about 9:30 or 10 at night, where there are establishments that young people like to gather and drink, which was a wonderful thing when it was all lively and pre-COVID, and now it's actually kind of dangerous. And we're trying to figure out ways to make it really clear to people that they need to be cognizant of the distancing and the covering. I don't know if you want to talk a little bit more about that, Jim, because I think we are going to try to, this is just kind of a warning for folks. We're going to be stepping it up a little bit, which I think we need to do.
Yeah, well, this harks back to my comments about the Arlington Restaurant Initiative. When the police, or when the multidisciplinary teams of police, the fire marshals, and public health have seen problems, then based on our relationships, based on the contacts that they have in the community, they will effectively announce that they are coming out to, monitor the situation a little bit more closely. And so I think that in the high traffic areas, the community can expect to see more of that here in the coming days and weeks.
Thank you very much. And someone asked, it may have gotten answered in the chat, I'm not sure, they wanted the number again for information for COVID, all kinds of questions, all COVID questions. That's 703-228-7999, 228-7999. And there was a question if people speak Spanish on that line. Yes, we do have Spanish translation available, and we have other languages available as well. It might take a little while to get people connected, but we have, I think, over 100 languages spoken in Arlington, and we're cognizant of that and try to serve everybody. There's a question about, will these updates keep happening? I think we'll talk about that maybe when we do our concluding remarks. Christian?
All right, we'll remember to do that. So another big area of interest in all of these among the questions are about what's happening with schools. And I think I can take some of it, and then Libby, we should sort of feel free to share anything you would like. And I don't know if any of our county staff have anything to share either. But some of the questions have been, are all of these public health metrics and the considerations and what they might mean for risk being shared with our public schools? Easy answer, yes, absolutely.
Yes. I can get
we have had Dr. Varghese available on multiple occasions and at will, to the public schools and helping them figure out their plans for reopening. I do want to reiterate that it's their plan. Our public health team is not making the call for them. They're using the information that we provide, and they're making the call for themselves. But with that, we recognize that there's a huge responsibility on the governmental side to mitigate any issues that occur because of whatever plan is ultimately in place for school reopening. We know at this point it's for everybody to begin virtually in the fall. And as one question points out, that means it's simply, it's more than just making sure people have access to the internet. It's making sure that they have an adequate place to study and to do their schooling in their home. This could be a limitation if you have a little bit of space, or you could even have a lot of space, but if you have multiple children who need to be, finding discrete areas of learning, that's a challenge. Also, just dealing with the many issues that families may encounter where having their kids at school provided opportunity. They may live in unsafe conditions. They may not have the proper supervision, not just from a teacher, but just from a caregiver at home. There are myriad circumstances where we're engaged with the schools constantly in trying to figure out solutions. We don't have anything concrete to share yet because the thoughts and perspectives are ever evolving. But I can give everybody comfort that I think we have identified the 1,001 issues that need to be mitigated, and we're trying to work our way through figuring out how we can.
Yeah, that's fine. I think I'll invite our manager to talk a little bit because he's in regular, Mark, you're in regular contact with Dr. Duran, and I know you've been talking about, places that we might make available and childcare issues in general, and nothing is like fully baked. So I'll invite you to share what you're comfortable sharing at this point. Thank you.
So thank you, Madam Chair. The conversations we've been having with schools just, and when I say just, on the 20th, received answers to a series of questions about what kind of needs there are. At that, originally had been to choose between distance learning or online learning. And one of the questions that was asked in that survey was, what are your childcare needs? So schools are right now doing a tally of all the needs that teachers and support staff might have for childcare. So Dr. Duran and I just talked about that this morning, and trying to total up the number of people in that category and see where they might be able to make space for them. Some good news, because the state has stepped up and made it easier if the schools decide to use school facilities for childcare. And I know they haven't decided to do that, but if they so chose, they now have the ability to do that. And we are actually walking some county properties with them this week and next week to see about making accommodation for kids. A lot of issues there. Also, we have the same needs on our side for our first responders. So a lot more to come on that. I know that Dr. Duran, I wanted to give him a shout out. He, for some reason, accepted a job starting June 1st, and he's 7 weeks into it, and he's hanging in there. So a lot of tough issues, and we're working really closely.
Thank you so much, Mark. And I'll just add, because we tend to focus on the properties, having the space, but then of course you also have to have the people there to educate, teach, watch the children, which is another whole issue. And of course, the part of what we're dealing with is chicken and egg. Teacher can't teach if his or her own children don't have someone to watch them. But if somebody's watching them, then we need to have someone there to teach, and it just kind of goes around, and it's a lot of problems we need to solve simultaneously.
And for people who are concerned, even though we're in tough budget times, we are making lots of adjustments to respond to the pandemic. The needs of the public schools are very much top of mind, as is understanding that there may be additional resources, put forth to deal with the plan for reopening and any mitigations. We, again, as we work through understanding exactly what those will need to be, we are also going to be of a mind to fully be able to prepare to meet whatever mitigations are within our power to deploy.
Yeah, and we're all facing it too. I just say, because you've got two school-age children.
Sure.
He's got a little one. I got grandchildren and a daughter. Anyway, this is a big issue, and we're well aware of it, and doing our best at this moment to get somewhere that'll be helpful. Yeah.
And certainly some other questions have come about the regional cooperation, which Dr. Varghese spoke of, and understanding how the pandemic is flowing through our community. We do work with our other jurisdictions in Northern Virginia, but also in the district as well as suburban Maryland. That includes regular conversation about what we're planning, what we're seeing, what we're planning. Each jurisdiction will, want to maintain its own ability to do what's necessary in their own local community. But I will say that we're seeing very good cooperation in terms of information sharing, best practice sharing, and most importantly, the sort of do no harm principle. Letting people know about what you're planning to do so that we can have a conversation if that's going to cause a neighboring jurisdiction who's going to be affected by your actions, any concerns on their end. So it's not perfect, but certainly the regular conversation is something that occurs. I don't know if Mr. Schwartz or Libby, you want to speak more to that, since you do a lot of...
something that maybe toss it to our staff, because I think what's important, what struck me is how these regional conversations are happening at all levels. So I'm on a regular conversation with the other mayors and chairs in the Northern Virginia region. Once a week at least we talk. Christian, you're on the COG board, and I know, working with your electeds, and so then you have the next one, what we call the CAOs, which would be Mark Schwartz and his compatriots. He's part of a group and has regular conversations. I think Dr. Aaron Miller has regular. At each level, each person doing it has conversations across, and then often if I can using hand language here, then we have in our own jurisdictions. And then we talk crosswise again. So it's a pretty good system, I think, as far as communicating goes. And we all understand the very basics, because it's pretty simple that viruses don't stop at the border and say, oh my, no, this is Maryland, I can't leave and go into Virginia. It doesn't work that way, and we all get that. I don't know if either one of the Schwartzes, Jim or Mark or Dr. Varghese or Aaron Miller, would like to talk a little more and elaborate a little bit more about that, because I think it's something that people don't see, because they just don't tend to see the meetings. They don't have the town hall like that particularly, but it's a lot of work that actually is going on, and a lot of time is spent on that. Mr. Mark Schwartz, I see you on my screen.
Yeah, I will start, but there's a daily rhythm. It starts off, around 8 o'clock, where Dr. Miller, Dr. Varghese, and both Jim and I have not earned honorary doctorates in public health, but maybe bachelor's degrees at this point. We have a conversation every morning. Ruben is having conversations with his colleagues every morning. I have a regular 2-time-a-week phone call with my colleagues. I'm going to let Aaron say, I think Aaron's probably on the phone more than any of us. Aaron is dealing with the emergency managers in the region and the state, and then there are conversations with the Virginia Department of Health, and I'll let anybody else want to add. That is, I think, at least a third of my day is taken up with collaborative phone calls.
Thank you. That's important to note, because as I say, I don't think people see it that much. It's really important. Dr. Miller, Aaron, would you like to?
I just want to reemphasize that in a lot of the questions that I see coming through on the Facebook chat, for instance, questions about testing capacity, right? And if some of the private providers are going to be able to meet things in the fall. Those are the same things that we are talking about within the region and how we address that as a region. Because we know, and you've both repeated it, Madam Chair, many times for us, is that the region and the interactions that we have across jurisdictional boundaries are most important. And so, for instance, every Friday at 10 o'clock, it's a Virginia Department of Health call with the emergency managers. Every other week, it's all the regional emergency managers. And then every week, it's the Northern Virginia emergency managers. And so, as Mark mentioned, I do spend most of my day now virtually coordinating with our counterparts on these things. And I can say that we share the same frustrations. And the good news is that we have seen in the past the Northern Virginia elected officials and their commitment to ensuring that we are well represented and our point of view is well versed with the governor to protect health and safety first and foremost.
Thank you.
We have oh, go ahead, Libby. I'm sorry.
Yeah, there's from going from the big picture maybe down to some very specific questions, and then if I might, because it's been here. I mean, these are important things. They seem small. Going to the barber. What if you go and get your hair cut, and then you find out, then the barber finds out that the person who cut your hair or somebody in the barber shop had COVID or has COVID. Are they do they need to let you know? How is that process going to work? And that would be, and then one is when can we have the insides of our cars cleaned at car washes? A very small, but actually it's something that gets into people. Apparently right now car washes aren't doing the insides of car. Dr. Varghese. Okay. Barbershops and car washes, please.
All right. So the barbershop and just any work site in a sense or business, obviously, if they know about exposures in their setting, they can work with the public health division staff to investigate those things. The other way we learn about these things is through the case investigation and contact tracing to see potentially where there may have been exposures, to then see if it's within a certain time frame, whether or not that constitutes a exposure. And so something as intimate as the barber-client relationship would be one of those things that if we determine that, we'd want to at least identify which of those individuals could actually be exposed. One of the things you need to realize, though, is if the barber, for example, lives outside of Arlington, and if the barbershop is outside of Arlington, it's someone else who will do that investigation. And it's going to be only as good as how honest people are in those things. As a general rule, people are, and then the other jurisdictions will let us know. So I think reasonably it's a good system, but could there be some slips? It's always possible. On the car wash situation, I think that's going to be really up to the business to decide what they wish to do. Because I think a lot of people haven't realized there's a lot of choice in this, and it's about a question of the risks that people are willing to take. Because not everyone, even listening here, has the same risk threshold. So imagine we're each doing things on a different risk threshold, regardless of what maybe the governor's phase is, because people's individual risk threshold could be different. And then what we're doing with a lot of these things is how do we come up with a community risk standard, which you can only imagine how that could be not an easy thing to do to figure out those things. And that's what's emerging in this process.
Thank you. Christian.
And, for everyone, I would just, as a PSA, would encourage you, if you need service technicians visiting your home or visiting service-oriented entities like a car wash, that you call ahead and ask about their COVID plans in terms of reducing risk. It's something that you should make a regular part of your conversation before you either expose your things or your home to other people to work on. And from my limited experience, I found people in the business community incredibly thoughtful about it, and they've made plans to protect their workers and to protect us, well beyond what I would have initially thought required. So I'm seeing some good responses from the business community out there. We have a question about what can nonprofits and the faith community do in responding to COVID? What are the most effective interventions that they can pursue at this point? And Libby, love to hear your thoughts. For me, I think the more we can have people connect to those who may not necessarily be on this town hall or having had bookmarked the COVID-19 website, the more that we can connect with people who may be disconnected from all of this, that's what's most needed, to make sure they not only get the information, but more so that we can have some way of understanding the magnitude of needs that exist in the community. While, we spend a lot of time trying to think of every conceivable way in which we can provide appropriate supports, we don't have the hubris to believe that we've thought of it all. And connecting people to us is incredibly important. So if organizations out there have communities, especially if they're marginalized or especially if they are disconnected, please check in with them, understand their needs, and if you can't connect them to us directly, make sure we know how to connect to them. That's just critical if we're going to be able to meet as many needs as possible.
Thank you. I think what we're discovering, working with particularly Arlington Community Corps and actually my own daughter and the PTAs, I think often it's the PTAs that are most really connected family to family, person to person. And in a number of communities, particularly our immigrant communities, they're not facile with the online and the, and the kind of devices and ways of getting information that we are, or not comfortable with it. And in a number of instances, I've found that people are comfortable reaching out to a PTA person or somebody else, another parent they know, and telling them they need help, or they've asked for help and haven't gotten an answer. Then that person, actually, the way it's been going, comes to me. I go to DHS. DHS checks, comes back, and a certain amount of times the answer is that we've been actually trying to call the person, but they're not picking up the phone, or they're not answering. And sometimes there's some paperwork and applications that just gets confusing. We try to be as sufficient as we can, but we're piecing together a lot of different kinds of assistance that sometimes require, paperwork. So if nonprofits, I think the more you can do sort of person to person, I think which is what you were sort of indicating, Christian. Some people just need, I know some folks are getting training from our Department of Human Services staff on how to handle paperwork so that they can, sit down distanced or else work over the phone with someone and help them go through the application process, kind of line by line by line. And that kind of very personal, very intense support is what some people need. And I'm just delighted actually to see how much people are just stepping up to do that and forming connections that are really necessary for us to get through this. I don't know if that answers your question, but there you go.
All right, I think we've pretty much answered most of the questions that we've seen, not entirely all, so I apologize if we haven't gotten to every specific one, but why don't we close out with more on what we do in working with our multifamily community in terms of signage and posting and information sharing within those areas where we have people densely housed who also naturally have areas to congregate, whether they be mail rooms or laundry rooms, et cetera. What are we doing, and then what are we seeing in terms of their ability to implement good guidance? Maybe Jim Schwartz?
Might almost be a Brian question. I don't know. Jim.
Yeah, well, I'll get it started, and then I'm sure Aaron and Ruben, Dr. Varghese will have something to add. But as has been noted on a number of these chats in the past, in areas like multifamily dwellings where there is not necessarily the ability to, within the space of a hallway or spaces that may be a little bit more confined, there may be a little bit more difficulty, as you're passing somebody in the hallway to maintain that social distance. So what we're recommending on top of, again, our constant encouragement for wearing face coverings, is that people be aware of their surroundings. If they step out of their apartment and they see somebody else in a hallway, they want to take note of that, figure out what somebody is doing, maybe take that extra minute to figure out what direction they're going in, or give them a minute to pass by before you go in the hallway. It's being aware of your surroundings and monitoring your behaviors. We acknowledge that these kinds of things are very difficult because they're not yet really the kinds of habits. I mean, we've built life lifetimes in acting and behaving in the way that we do, and now we are working against some of those inculcated habits, the kinds of things that we've been doing for a lifetime. So encouraging people to be aware of their surroundings, take that extra moment to see, what things look like is most important. We've been working a lot with the community, outside government to encourage, as we have demonstrated earlier on this chat, the We Are Covered campaign, to put up the posters that indicate that this is a business that is adhering to the governor's order of requiring masks to be worn inside spaces. And Madam Chair, as you indicated earlier in the chat also, people should vote with their feet. If they are uncomfortable in a place that is not enforcing that requirement, if they are a little bit more laissez-faire about people coming in without face coverings, then maybe, choose to do your business elsewhere. Having said that, let me also acknowledge that there is a small portion of our population for which wearing a face covering actually does present a higher health hazard. And so don't automatically assume that when you see somebody without a face covering that they are being obstinate or against the governor's order. There may be a very good personal or health reason for that. And this is where we like to just say over and over again, we're all operating in a very stressful time. This is the time to practice just a little more gentleness, a little bit more opportunity to see the other side of a situation and help somebody through, a difficulty without necessarily, lashing out in anger or frustration.
Thank you. That's always a good reminder, Jim.
Indeed. All right. So with that, I think we're going to close out. If we have any other additional questions that we can answer that have come in via text or chat, we will be sure to get in contact with the questioner. But we have very much enjoyed this opportunity to share the latest information in what has been going on with COVID in our community. Libby, I guess you wanted to address the question as to how these will continue. As people may have noticed, we've moved to an every other week schedule, and I think that's what we will intend to do for the foreseeable future. But of course, we remain flexible and able to meet the need as it manifests. But right now, and particularly as we move on with the summer, we think that the every other week schedule is probably appropriate. Anything to add there, Libby?
Yeah, no, I think that works out. That would put us back here, and it would be Katie and Matt, I think, on August 7th. And I agree. I think the 2-week schedule is good in that I think, as we all know, things keep changing very rapidly. And obviously, if there are not a whole lot of questions, we just won't go as long. But I think people can count on us being back here August 7th. And of course, we welcome any kind of questions that come in up until that time over email and every other kind of way that we get questions. So happy to do that. It's important that we keep everybody informed and stay in touch. These are difficult times. I liked Jim's kind of thing. Be gentle with each other. Mm-hmm. I think that's a good. So we can add that to the face covering, please. As I say, I still live really like I'm in phase 2. Because I'm just being extra careful. I think you just need to do that if you can. But wear face covering, wash the hands, stay 6 feet apart. But don't forget to just pick up the phone and call a friend that you haven't seen in a long time. That can help them, and that can help you too. The human connection is important. Not only have we been inculcated in certain ways to behave with each other, it's actually in our DNA, which makes this separation really, really hard for people. So everybody stay cool, stay well. Really appreciate everything people are doing and our staff are doing. And thank you, Christian. Any other final words to close us out?
Well, just a couple more things. So there is one question that I overlooked that we can answer pretty quickly. Someone asked about yard waste collection and the status of that.
Yes.
Just recently had an update from our manager, which due to ongoing staffing issues, actually with the contractor who provides our refuse services, we've been unable to have at-home collection of yard waste. We do have 2 drop-off locations in South Arlington at the Trade Center and in North Arlington at the 26th and Old Dominion area, where one can drop off their yard waste if that's convenient to do so. We recognize that that's not going to be possible for a lot of people, so we want to get that resuming as quickly as possible. We have heard that the contractor hopes to have those staffing issues resolved in the next 30 to 60 days, but that's the time frame that we're looking at. And of course, people are wondering if that means that they will ultimately be paying a small increment for that level of service that they're not receiving. And at this point, that means that every household would receive a credit of about $8. And we're looking to figure out how the best way to do that once we resume service, and then can apply that credit to a subsequent bill. And that also is a reminder that in addition to COVID, which dominates all of our lives, we have other ongoing business all the time. And one of the most important activities that we've been engaged in is ensuring that everyone gets counted with the decennial census. Right now, it is ongoing, where we're trying to count every Arlingtonian, and we have until October to do it. Right now, we're at about 71, 72% of Arlingtonians have responded, but that, of course, means that nearly 30% have not. In real terms, that means that significant dollars will not flow to Arlington's community. Grant funding and other awards that are based on population, a less accurate undercount, means that we don't get those resources. More importantly, it means that our representation is compromised, all manner of our community being able to assert its fair share for both funds and political power compromised by a census undercount. So we need to get everybody counted. And as it relates to the pandemic, in order to make sure that we don't have census workers out there risking their health and risking yours by going door to door trying to get everyone counted, we need everybody to self-respond as quickly as possible. So please, I assume everybody on this call has already been counted, but spread the word far and wide, please. And with that, if there is nothing else, we can sign off and wish everybody a happy Friday, and board members will be back with you in 2 weeks.
Thank you. Stay well and stay cool. And stay distanced. Thank you, Christian.